What is the Global Shapers community? So the Global Shapers community is an initiative of the World Economic Forum. It was established in 2011, so most of that about 14 years ago now. And it is a network of young people who are taking action, driving conversations to create change and shape our local communities. And so, what does that look like? First and foremost, we are a community of young people who are looking to make impact in various areas. So this could be healthcare, just like we're having this conversation today. We do work in other impact areas like education, inclusion, civic engagement, and climate change. And our members are called shapers. And this is because for us, our goal and our main objective is to develop ideas and initiatives that solve the local problems that exist in our community. And so we are the Lagos chapter of the Global Shapers community. There are over 500 hubs across the world. So, 500 cities have hubs. And in Lagos here, we believe that our charge is to shape, a healthier and more productive Lagos. If you would like to learn more about what we do, if you'd like to stay connected with us, we are everywhere on socials. And you can follow us at Lagos Shapers just to, stay connected with us and be a part of all our initiatives. Now, this brings me back to what our session is about today. Unfortunately, breast cancer is the leading cause of cancer-related deaths in Nigeria. Over 60% of cases are not diagnosed until they've reached a super advanced stage. And this usually results in high mortality, as we see in the case with breast cancer. There are also lots of misconceptions that people hold, and this limits the awareness and knowledge, right, that people can actually take with them to make sure that they are taking care of themselves, to prevent, to manage, and to reduce, this rate of mortality that we see. And that's why for us, we thought it was very, very important to have a conversation, a chat like this, so that we can explore what the actual facts are, right? And our goal is for every attendee here, that's a part of this session, to go back at the end of the session with factual information about breast cancer, and also to be willing and able to share this information with your family, with your friends, with those in your community, right? And our goal is to make sure that we're all equipped to, better help ourselves and help other people. And so today we have, like I mentioned earlier, we have some key healthcare professionals with us. We have Abiola Ayilara, founder of MyCare Assistant. We also have Ifeoluwa Dare-Johnson, who is the founder of HealthTracka. And finally, we have Dr. Stephanie Egboh, who is the medical doctor at HealthTracka, and she's also a women's health advocate. So without further ado, we'll jump right into the session. But before we do that, we will do a quick round of intros, starting with Abiola Ayilara, then we will go, into the actual discussion and into the meat of the questions. So if Abiola is here, you could please introduce yourself, that would be fantastic. Abiola, if you're speaking, you are muted. Okay. It's possible that she's still trying to figure out, whatever the tech stack is. But Ife is here as well. Ifeoluwa, if you are able to unmute, please go ahead and introduce yourself.
For sure. Hi, everyone. Good evening. How's it going today? Great to be here. My name is Ifeoluwa Dare-Johnson, and I'm the founder and CEO at HealthTracka. So for people who don't know HealthTracka, we are driving access to early diagnosis with a focus on women's health. So we leverage innovation and technology to do that. So looking forward to the conversation around this breast cancer today. Yeah, thank you for having me.
Thank you so much, Ife. It's fantastic to have you, and well done on all the amazing work you're doing at HealthTracka as well. I'm excited to dig a little deeper in the conversation and learn a little bit more about your approach, and some of the work that you are doing. Coming back to Abiola, if you're able to speak, Abiola, please let us know so you can introduce yourself and then we can continue.
Yeah, hi everyone. I'm so sorry. I heard you did last time, but something came up. I had to quickly, do that. But apologies. So thank you for having me. Like you said, my name is Abiola Ayilara. I'm a nurse and also a health informaticist. So we more like the founder of MyCare Assistant, and here what we do is we provide care support services and also educate people on care. So I'm happy to be here and to join the conversation. Thank you.
Fantastic. Thank you so much for being here and joining us. I think we're still expecting Dr. Stephanie. I'm not sure she's here yet, but when she is, she can come on and speak. In the meantime, just before we go into the conversation, for everyone, we will sort of have some sort of, chat really. So I'll be asking questions, Abiola and Ife will be providing insights based on these questions. And when we go through, the initial list of questions, please, participants, feel free to drop your own questions and thoughts in the chat box, so that when the initial sort of chat is over, we'll be able to take audience Q&A as well. So please feel free to drop your questions in the chat box while the conversation is ongoing.
Sorry, Abiola, Dr. Stephanie is actually on the call.
Okay.
Yeah.
Oh, hi, Dr. Stephanie. I'm so sorry, I must have missed you. But please
If you could
go
let
ahead
us
and
know what name joined with, Abiola, sorry to phone thing, so that we could,
I'm
make our call.
unsure. I'm unsure. Her name doesn't show. It might be a device, actually.
Yeah. Hi, Dr. Stephanie, if you can hear me, thank you for joining us. I don't know if you could rename yourself, so it's easier for us to identify you. Thank you so much.
Okay, I think somebody unmuted.
Probably you could let us know what your device name is, so we can make that faster.
Okay, that's fine. I think while that's ongoing, we can actually start, and then once that's sorted, we'll have Dr. Stephanie also introduce herself and join the conversation. All right. So my first question I actually want to direct to Abiola. And my very first question is, what are some of the early warning signs of breast cancer?
Right. So I don't know if you're going to allow me to use a storytelling style, because I think that is more relatable. So for me, I think sometime 2012, my aunt called me and mentioned that she saw something, or that she actually had minor accident whereby she hit her chest against a metal bar. And that was really painful. And, for a long while, she didn't do anything about it. And later on, she realized that she could feel the lump, but she just assumed it was that that it was the metal stuff, the accident that caused it. Anyways, we went to the hospital together and realized that she had a lump in her breast. And like you mentioned, if it's about myths, right? Most of the early warning signs of breast cancer, it's usually what they've already told us about, a lump in the breast that you can feel by yourself or by having a scan done. But sometimes things can happen, a minor accident can happen, and if anybody has a predisposing, attribute to that, it can lead into, breast cancer. So let us just stop there and then we delve more into it.
Fantastic. Thank you for sharing that initial story. Ifeoluwa, I want to also direct the same question to you. In your experience, and I'm happy. I'm also excited to learn. But I want to believe that it doesn't show up the same way for every woman, right? So what are some of the early, warning signs of breast cancer?
Yes, you're right. It doesn't show up the same way for many women, for the same women. However, there are also just some symptoms that, kind of the general, that all, once you have that symptom, you just need to go in and see your gynecologist or see your doctor at all. So typically, we tell women, if you notice any change in your breast, right? And that's why, sometimes, we encourage women to be familiar with their bodies, right? So that nothing happens and you're not even aware that, the shape has changed, the way it's looking has changed, whatever that is, right? So that's typically the first sign for most women. They notice that something changed in just, the way that their breasts look. And of course, the general ones are around, do you feel any lumps that that wasn't there before? Is there any pus? Is there any liquid coming out, especially if you're not breastfeeding? And I can cite 2 or 3 people who the early signs were, they just decide to feel milky substance come out of their breast. And then because of that, they went in early to see the doctor. Thankfully, because it was early enough, it was benign at that point, they were able to take out, the lumps, and, that was it. But most of the time, the problem is when, you just ignore and like, oh, well, maybe it's just hormonal, maybe, whatever. So those are the signs that generally, practitioners and medical professionals will tell you to look out for. I really would love Dr. Stephanie to chime in here as well. And I'm done. But yeah.
Fantastic. Thank you so much for sharing that. Dr. Stephanie, it's great to have you. If you could please introduce yourself very quickly. We're so sorry. We didn't realize it was you, but please introduce yourself. And then as a follow-up, just tell us a little bit more about the early warning signs that, people can look out for when it comes to breast cancer.
Hi everyone, good evening. Sorry about the network glitch I had a bit earlier. So yeah, I'm glad to be here. Thank you for having me. So just like Ife said, every woman is different and our bodies are different. So the most important thing when it comes to the signs and symptoms of breast cancer is knowing your body, right? It is said that a lot of women do not know what is normal for them. So when there's something that's not usual, when there's something that abnormal, they are unable to pick it up. So generally, for most women who have cancers, the first thing that comes up is usually a feeling of a lump in the breast. It might be very small, and then most people would most times tend to miss it. And occasionally, these lumps might not actually be in the breast, and this is where the problem comes. So most times, the lumps are in the armpits, the axillary region. That's where, in most cases, the lump starts first. And then when people find lumps in their armpit, they usually say, oh, it might just be a ball. And then they tend to overlook or ignore it. Then for a few others, there are skin changes, right? So you're seeing red discoloration on your breast area. You're seeing a discoloration that is different from the normal skin of the breast. So if you're a very light-skinned person, you're seeing the skin around your breast is a little bit reddish than usual, right? Then that is abnormal. You're supposed to get that checked out. Then in some cases, it becomes abnormally hard. Like we've had a lot of people coming with complaints of, oh, my breast feels harder than usual. That is a very typical symptom or sign of breast cancer. Then there's this thing called peau d'orange. So the skin around the breast starts looking thickened like the way the orange skin is, with those tiny, tiny dots on it. That is a very classical, typical thing for breast cancer. Then, like Ife said, people have different types of discharges from the nipple. You can have milkish discharge, you can have bloody discharge, you can even have occasionally green discharge from the breast. So these are like the most common symptoms that are around in this environment that we see all the time that are very classical for breast cancer. Thank you.
Thank you so much for sharing that. I think immediately what jumped out to me is what you said about where lumps tend to show up most. I never knew that you should be checking your kids. So this is very, very important information to have. So thank you for sharing that. As a follow-up question, when people now see some of these signs or they start to, observe some of these changes, what is the next best thing to do? In my experience, and I've had a couple of friends who have seen lumps, and I've had lumps removed. I think there's a lot of panic that immediately sets in and, immediate stress. But professionally, what should be the next steps that you should take? And I would love if Abiola could answer this, please.
So the ideal thing, thank you, Abiola, namesake. So the ideal thing is to, go to the hospital and then have yourself checked. Now, one other thing that I think we didn't mention is that some people have inverted nipples. And again, story-wise, I know someone that had inverted nipples and just assumed that she had breast cancer. And she literally had like a mental breakdown around that. She refused to go to the hospital. She was scared. She literally just assumed that this was the problem. And we had to, try to put all the evidence in front of her to say that just because your mom had it yes, you have that much percentage or higher risk of having it, but that doesn't mean you currently do. It could just be a structural, a structural thing for your breast to be inverted. However, you need to get to the hospital to have this checked. So majorly, what we encourage is that people have a mammogram done, something as basic as an ultrasound scan and then a mammogram to determine the type of, the type of tissue, the type of cellular, mechanism that the lump or the cancer is exhibiting in the person's breast.
Fantastic. Thank you so much for sharing that. As you were speaking, you touched on something that was actually a question that I had, and this is about the role of genetics when it comes to breast cancer. You mentioned in the story that you were telling that just because a mom has it or a grandmother has it doesn't mean that you do. But I wanted to just learn a little bit more about what that relationship is between if somebody's mom or someone's grandmother has breast cancer, how susceptible are you? What role does genetics really play in when it comes to breast cancer?
Thank you. So genetics play a major factor because if you have a mother or a sister or a daughter that has got breast cancer, then there is that 50 to 60 or 70% chance of you also having it. And the good thing is that because of this higher risk, it is very important that the awareness is high, the investigation is also relatively high so that you can always check yourself to be sure. I know people suggest that for women, you should begin to do those investigations from the age of 40 or thereabout. But young people as young as 20, they can always do this maybe manually by using their hands. But then it is not really cast in stone. And to even properly determine how much predisposition one has is to more or less do a form of a genetic testing, to really determine if that person has those particular cancer tumor markers in their cells.
Okay, that's very interesting. And if you don't mind, I would like to ask another follow-up question to that. And when you talked about genetic marking and just doing the test to figure out, are these tests like readily available in Nigeria where even without necessarily knowing what you're susceptible to, you are able to sort of like do an initial test, just get a sense of what could potentially happen?
I may not be in the position to answer explicitly. I don't know if Ife or Dr. Stephanie knows if precision medicine or genomics kind of interventions are, available in Nigeria. But I know that in the UK, yes, there are a lot of genome sequencing data collection just to determine how much, the tumor of people that has got me all these breast cancer cells in them. But in Nigeria, readily, I'm not sure about that.
Thank you so much. If you could shed some light, it would be.
Yeah, I feel like my face already tells that I want to like, yes, it exists. And it has existed since like, because I've been in diagnostics for maybe 5-6 years now, or more than now actually. And we've been doing BRCA test in Nigeria for close to at least 7 or 8 years. So it does exist. It's a bit pricey, but I mean, obviously, you cannot put a price on your health, and physician, medicine, genomics, and all of these things are beginning to get, some spotlight in Nigeria. So please reach out to us. Definitely, you can get some BRCA test done. That helps you determine if you're predisposed to breast cancer. We all know the story of Angelina Jolie. I mean, you heard that she did some of these tests.
Probably can tell us, actually. I think it would be great if you tell us.
Oh, really? Sorry. I always assume that people know the story because obviously, she's a celebrity. And then she, just like as you said, based on genetics in our family, breast cancer actually runs. So she went public with the fact that she did do, a precision medicine test to just predetermine if she was susceptible to it. And our result came back that it was 50-50. Right. So which meant she could have it. And she didn't want to take a chance. So she cut off, she had her breasts taken off, really. Of course, I mean, she obviously can afford to make her boobs look great regardless. But obviously the point was even just that test exists and it allows you to be in control and be proactive about it, right? So it does exist if you know that you can, because sometimes, we plan to travel, we plan to buy a car. These are some of the things you plan for, save for, and then you just do the test. At least you're aware and know. Again, this is the #1 leading cause of death in the entire world, really, when it comes to cancer-related deaths, especially for women. So it is definitely worth the price. But yeah, it does exist.
Thank you very much. Because I remember, I don't know if I could just come in again. I think then what I know was HER2, HER, the hormonal one. Is that correct, Ifeoluwa? That was
yeah. I mean, I think, we've obviously advanced a little bit more. So the BRCA is much more precise.
Definitely, yes.
In fact, there's a partnership that, we're about to close now that is even more precise than BRCA. I'm hoping that, in a few we'll be able to announce and just share that. But yeah, as technology, and innovation comes in, we're looking for what are the newer ways, what are the more effective ways, especially when it comes to precision medicine, to be able to determine these things. Yeah.
Fantastic. Thank you so much, Ife and Abiola, for shedding light on that. I would actually love to dig a little bit deeper into what the options are. Because now you've mentioned BRCA, Abiola has also alluded to the HR2, if I'm correct. Sorry. But are there any additional options? You're talking about a new one that you're looking to introduce in a few days. Are there any other options that people should know, right? Because I think that part of the challenge is people actually don't have information. For example, I didn't know that this was even available to do at all in the country. But the more people actually know the options available to them, the better they are able to make decisions and, carve a way forward for themselves. So if you could please just share a little bit about what the options are that people can pursue to just learn a little bit about their history and what they are susceptible to.
Yeah, I mean, this is where I want to say, the doctor needs to enter the room and talk. But just maybe as a prelude to that, before Dr. Stephanie, comes on. So when it comes to diagnosis, there are 3 ways we look at it, right? So there is awareness. There is prevention. There's what am I saying? Awareness, prevention, and treatment. Yeah. So the first thing, that we talk about is awareness, right? Sometimes if you don't know, you don't know. I remember just like you, Abiola, that I went for a breast scan and then they told me to raise my hand up and then, and I'm like, what are we doing here? This is not even part of my breast. But obviously, as Dr. Stephanie says, that's actually where you should be looking for lumps, really, at least part of it. So it's just even the awareness of what are we looking for here, and all of that. And then how often should you get, your breast checked? Yeah, because sometimes you check by yourself, but what if you, how about having a professional check you? Most people will talk, say, oh, you know what, but aren't you meant to wait until you're 40? So then you start to check. But I mean, you and I, everybody here, I want to believe, knows someone who is younger than 30 who have had breast cancer. In fact, just as I was speaking, one of my friends passed and heard us. I'm like, oh, this other friend of ours, got to, traveled basically to the UK 1 month later, basically lost her life, and it was due to breast cancer. And I'm like, how are women our age dying? It doesn't make any sense. We're still too young to be talking about cancer. But guess what? The awareness of it is the first part, because once you're aware, then you can be, and in fact, you can seek information. You can ask your parents. Sometimes we hear that, oh, grandma died. What happened to grandma? Why did she die? And most of the time we have no history. We just know that, oh, they just told us one day that, we lost someone. Oh, an auntie died. Oh, she fell here. Oh, okay, that's it. What exactly happened? How do you get medical history of your family so that you can't know what? So I think that awareness is such a huge bit. And, obviously that's one of the reasons we're doing this. And then we then move to prevention. What about my lifestyle do I need to change to ensure that I live a life that delays diseases, at least the onset of disease, but just not to go too much into that. Obviously, that's where, treatment, once you begin to figure out that, there's something wrong here, how do I treat? Who do I go to? And this is where I hand over to Dr. Stephanie.
All right. Yeah, thank you, Ife. Thank you, Abiola, for having me again. So when it comes to breast cancer, right, there are levels to it. So Ife has talked about the awareness. So I'm just going to get into prevention, like she mentioned, right? So ideally, every woman starting from age 18, not even 18, so long as you have breasts, because I mean, we've recently had a case of breast cancer in a 15-year-old girl. So long as you're able to menstruate, right, it should be a monthly thing where you get to do your self-breast exam. And it's best to do just after you have finished your menstruation, just after you have finished your period. So in the morning, you have a cold bath, you check your breasts by yourself, right? Then for women who are less than 40, we advise an ultrasound scan every year, an annual ultrasound scan of the breast. Ultrasound scans are not expensive. I mean, we all buy expensive hair, expensive clothes, and all of that. So if it's something you can gift yourself, annually you do a breast ultrasound scan just to be sure that there's nothing there, right? And ultrasound is advised for women who are younger because of the density of our breasts, right? A mammogram wouldn't typically find anything in the breast of a younger woman as compared to an older person, because we have denser breasts, we have more breast tissues. So ultrasound for ladies that are less than 40. Then for those that are more than 40, then we recommend the mammograms, and it should be more frequent, at least every 6 months. And then if you have a family history means a first-degree relative, a mom, a sister, a brother, a father, and then if you have a history of a male, then the risk actually increases, the BRCA gene. It's usually advised that if you have a male family member, a male first-degree relative, like brother or father, who has breast cancer, then the BRCA testing should start as early as 15. You can take the genetic testing as early as 15 years, just to be sure that you're not susceptible to the gene. Then if you have a sister, a mother with the condition itself, then it doubles or triples the risk. Then when it comes to the diagnosis itself, diagnosis of breast cancer is made by 3 methods, right? So we have the clinical diagnosis, we have the medical diagnosis, right? So the clinical diagnosis is you find the lump. So the issue now is that for most women, like I said earlier, most women do not know what is normal in their body. So for most people that have come up with breast cancer or breast lumps, it's usually, oh, my husband was touching me and then he found this, or my boyfriend was touching me and then he found it, and then he said it was abnormal, and then I had to go get it checked, and then I found out it's that. So if you know what is normal for yourself, then if you check and then you find something that is abnormal, then you can escalate, go get it checked. So that is the part of you find it yourself, then we do the clinical diagnosis. Clinical diagnosis is you're in the hospital, the doctors check, then the imaging comes in, right? So if you find something, then we do an ultrasound. If it's somebody that is less than 40, if you're more than 40, then we do a mammogram, right? The ultrasound will pick, oh, there's an abnormal lump or there's something that is abnormal in the breast. Then if we find that, then the next part is the biopsy, right? So we take out the lump and then we get it examined histopathologically. One of the things that people usually think is that all breast lumps are cancerous, and I mean, that's not true. Breast lumps are quite common in this environment. So that's it. Thank you.
Thank you so much. Thank you so much for sharing that. There are so many things I was picking up on as you were speaking, two particularly. And the first is you talked a bit about if the men in your family have breast cancer, or have had symptoms in past, or whatever it is, it means that you are even more susceptible, right? So I wanted you to touch a little bit more, Dr. Stephanie, about what breast cancer looks like in men. We do have a few good men on the call. I think it'll be helpful for them to also, just get a little bit more information about how that kind of shows up in men, because I think it's easy to kind of just zone out when the conversation is about breast cancer, because you just assume, oh, it's women, but we've seen cases where like it's also affected men, and men are also susceptible. So it would be lovely if you could just touch on that a little bit.
All right, thank you. So in this environment, usually for every 100 diagnoses of breast cancer, there is usually one man. So it's like 99 women, and then there's the man inside. So typically for men, I mean, men have breasts, just that they are not as detailed or as not as ours, but they have breasts, and then they have breast tissues. So typically for men, when they have breast cancer, it's not going to look like that in women. But one thing is common, right? The lump in the axilla. So the men might not have lumps in the breast itself, but the lumps in the armpits, that's the axilla, it's always there. I'm going to use the word, it's always there. Then most times the skin changes too. And then for those skin changes, it's usually in the advanced stage when it's like gone really, really bad. So you're seeing the hard skin, the same just like in the woman, with the dimpling, the typical orange. If you can picture the skin of an orange, that is the typical look of a breast cancer skin. Then the nipple discharge, bloody, it could be bloody, it could be greenish, it could even be brownish. Occasionally, it could be milky discharge from the breast too. And then if in the worst scenario, like the worst of it, you could actually see ulceration, that like typical sores, wounds on the breast. And that's like when it has gotten to the worst of the stages. And that's how most men in this environment present, because I mean, men don't know that men could get breast cancer. So if there's something in your armpit, you might just assume maybe it's just a boil, and then you might tend to overlook it. So that's it, the late presentation.
Right. That's very interesting to know, that for men it means that they will need to even pay extra attention, because it's even harder to catch it earlier if, I get what you said correctly. But thank you so much for sharing that. I think we've talked quite a bit about, the role that genetics play, and, how it shows up in terms of like family history. I also wanted to discuss a little bit about what other factors can make people more susceptible. So whether it's like, lifestyle factors or any other thing really, are there, so I don't know this, but is it possible, or is it known that in some parts of the world, it occurs a bit more frequently? Just, little pieces of information like that could be helpful for people to have to know what else can make them susceptible to breast cancer? And I'm asking all three of you actually. So maybe Dr. Stephanie can start, and then we'll go to Abiola, then we'll finish up with Ife.
All right, thank you. So when it comes to the risk factors for breast cancer, right? So we have the modifiable risk factors and then the non-modifiable risk factors. So the non-modifiable risk factors, it means that there are things that you cannot change, right? So you being a woman is a risk factor. I mean, you're a woman, breast cancer is more common in women. So being a woman is a risk factor for breast cancer. Genetics is a risk factor too, is actually a very important one. That's that for that. Then I want to really emphasize on the modifiable risk factors, the things that you can change yourself, the things that you can work on that would go a long way. So we have diet, right? So it's been said that consumption of a lot of processed food, inorganic food, it causes a lot of cells to change. I mean, these are chemicals that are taken into our bodies. So our diet plays a very important role in our lives as individuals, right? Even from as little as when we were small, the changes might not really happen drastically, but diet has a very important role to play when it comes to breast cancer. Exercise, I mean, like living a healthy life, has its own role to play. Women with denser breasts, fat, obesity have a higher risk of having breast cancer. And that's not to say that women who are slim cannot have breast cancer, no. But women who are on the bigger sides have higher risk for having breast cancer. Then smoking. Smoking is a very big risk factor for a lot of cancers, and then breast cancer is on top of that list as well. Then we also have the use of oral contraceptive pills. Oral contraceptives predisposed to breast cancer. Then the use of hormonals in any form, hormonals generally would increase your risk of breast cancer. So anything that can raise your levels of estrogen. So most breast cancer cells have the estrogen receptors on them. So if you have a lot of estrogen in your body, it kind of makes the risk go up. So people that have very early periods, as early as 11, 12, 13, very late menopause, people who have not given birth at all, because when you get pregnant, the entire period of your pregnancy, your estrogen goes down and then your progesterone levels go high. So progesterone is kind of protective for breast cancer, but estrogen favors breast cancer. So in any state or whatever that can make your estrogen levels to go up for prolonged periods of time can increase your levels of your chances of having breast cancer. Thank you.
Thank you so much for sharing that. I think that's very helpful. Abiola, do you have any additions to what
Yeah,
Dr.
I think Dr. Stephanie has really exhausted majority of everything. But what I may want to add is that even our mind has a role to play, right? So how you think, how you perceive yourself, the way you think will determine the kind of habits you would have. And the habit you have will determine the lifestyle you're going to have. So when we begin to consider how we think about ourselves, about our body, that would influence the choices we would make, that in turn will now influence what, what lifestyle choices we end up having that can then predispose one to breast cancer. So our mind also play an important role. Thank you.
Thank you so much for that important note. Ife, do you have any extra additions?
Yeah, I mean, both of them are the medical professionals here, yeah. So they've exhausted everything. I guess, what I would add on top of that is that women need to prioritize themselves. We need to prioritize ourselves. Again, a lot of the work that we do is in women's health. So we're always advocating we advocate for investment in women's health, but even just from like a personal point of view, how do you invest in yourself, right? Similar to what Abiola had mentioned, that, just even your mindset about yourself, the way you treat yourself, the self-care that you need, because sometimes it's unbelievable that, someone says, you're knowing that you have breast cancer at stage 4. How? how don't you realize that something has changed? But it's also, it can happen because we know how as women, we put everybody first, as opposed to, before ourselves, you put your husband, you put, sometimes even people who are not married, even their family, maybe you are the first child or something, your parents, your siblings, everybody comes first. You're not even thinking, you're working, you literally are putting yourself last, and then you don't even know when something changes in your body. So nowadays I'm an advocate of, just intentional self-care. Go to that spa, let them pamper your body, so that the next time you go and you don't feel the exact, that there's something wrong here. So I want, and those are things that I think that because also there's a mindset that you're in tune with your body, that you're in tune with, I want to live long. What can I do to enhance that? My waist is expanding. I can see my weight climbing. What do I need to do? I want to look into the mirror and feel good and look good. And those things have compound effect on how I think about my health. Because now I'm like, what are the things I can control? Breast cancer, cervical cancer, all these things you can control, at least to a large extent, what happens before it happens, right? So it means I can be proactive. I can go in, I can even say, okay, for my birthday is the day every year that I reset and do my annual checkups, and all. But it comes from just being intentional, loving yourself, just knowing that you deserve, a life of ease and soft life, a cutesy, a demure, a whatever life that you need to live.
Thank you so much for sharing that. That's very important. And that actually touches on something that I've been thinking about as you've all been sharing. And that is the concept of awareness and breast awareness. This is literally a term that I just learned in the last couple of weeks, about being aware actually of what's going on in your body. How can you be more in tune? It's so easy to get carried away with when life is lifing and so much is going on that you actually don't know. And then you just realize that I don't feel good, or you now realize after something has advanced that, oh, that's why I wasn't feeling quite all right. But I would love if we could go in a bit deeper about like that awareness and self-awareness and breast awareness. What does that look like? What should we be doing regularly? So beyond, your breast checks. So apart from your breast checks, what else should you be paying attention to that can help you catch some of these things, even beyond breast cancer, right? And help you live like a healthier, happier life. Abiola, if you would love to share, that'd be great.
Yeah. So honestly, we've said it all. But again, exercise is very important. And so I'm a very I'm a neuro-linguistic person. So I go down the thought pattern of how people think and perceive themselves, right? And this is very, very crucial, really, for you to be able to even control anything that happens in your life. That being said, I have a daughter. She's 1 year old now. When she was about 6 months, I can't remember what happened. I just noticed that my breast was very, very painful and it was so uncomfortable. And then I had to start, telling myself things like, what is going on? Why am I having this terrible pain? Right. And before I just unconsciously, I dressed up and then I took myself to the hospital. And I could remember my husband called and was asking me where. I said, no, I've gone to the hospital to do what? You didn't. I just felt like it had become autopilot, meaning that you sense something, you're not comfortable about how you're feeling. You quickly do what you take action. And then I went for an ultrasound scan, like Dr. Stephanie mentioned. And it just showed that it was just many maybe milk ducts that are just bigger or something that is causing the pain, or maybe my daughter maybe hit my breast or something. But the mere fact that I am aware, like I mentioned from the onset, my aunt died of breast cancer, and how we came about knowing it was all about what I saw. And I told myself that I'm going to do right by myself, my future generation. I'm going to be careful and methodical about what I eat. I'm going to be intentional about my health. I'm going to take my exercise seriously. I'm going to be holistic in the way I even eat or even interact with people, the air around me, the energy around me, everything around me. All of these things add up, because trust me, people have cancer just by being in stressful situations. they don't have any genetic underpinning that could warrant them from getting it. But just by living a stressful life, the chemicals in their body, all their hormones just go haywire, and then these things happen, right? So we see these days that there's the advocacy for eating right, eating healthy. We would always come across processed food. We would do that. But we need to be able to make informed choices for ourselves and say, okay, what am I going to do? I learned about even fasting reduces cancer just by fasting, be intentional about it. Like maybe one day off, one day on. These are just the little things that we need to know about to be able to, curb this menace. And I think they're doing well in developed countries because though it looks like the numbers are high, but it's not as a result of lack of awareness. People are more aware about breast cancer. Thank you.
Thank you so much. Ife, do you have any additions to that?
Yeah, I mean, such great points by Abiola. And I guess, there's a word that I've been saying we need to mention all day, which is inflammation, right? So one of the major reasons why cancer and all of these things happen is because there's an inflammation, and then the cells is trying to protect itself, and then it begins to multiply, and all the haywire, this is like when these screws get loose and everything just happens, right? So when we talk about lifestyle, is how do you manage the inflammation that happens in your body? How do you ensure that you're eating well? A lot of people talk about gut medicine. I was in New York. Gates Foundation they have this annual goalkeepers event. And I was blown away that the whole world is now talking about gut health, right? It's just saying, how do you even, what you eat, how you ensure, sometimes we're so used to our bodies being doing whatever, and we think is normal. So it's just the way you eat beans in Nigeria and you get gassed up after, and we think it's totally normal, right? And we just go about like, oh, it just happens when I eat beans. That's actually your body telling you that something is wrong here. This is not normal. But we take it as, oh, anytime I eat this happens, I just go around fatting, or I feel bloated. Why are you feeling bloated, right? So, and I guess Abiola mentioned something as well about the Western world are beginning to do something right there. I've been doing a lot of travel in the past 2 years around, to the West, Europe, UK, US, and it's mind-blowing to me as well how intentional people are getting around what they consume, what they eat, because, people are trying to reverse conditions. People are trying to delay the onset of diseases, and they're realizing what you put in your body is a number one indicator of how healthy you're gonna be, right? So people are becoming vegetarian. Some people call themselves keto, whatever. And, at some point, it's easy to just stand back and judge them. I'm like, oh my God, you're just going to be eating meat, and all. It's because people are following studies, people are following, you're trying to hack good health, basically, right? That's what you're trying to do, right? And I find it, my background is medical science. So the scientist in me likes research. So I'm typically very curious about that. Just as you said, Abiola, as well, even just personally in this year as well, I've also been very intentional, and everybody needs to be about their health, because that's the only thing. Once you take that one away, that's it. And this life is interesting, folks, right? You want to live your best life, and you want to be in the best shape and the best to enjoy what God will bring your way, right? So one, I would say that one of the things I found very useful is exercise. Most of the time when we talk about exercise, people think about, people are carrying huge weight and you're thinking the sweat. Sometimes just daily works. My baseline, I tell myself, is 10,000 steps every day. I do not care what's happening. If it's raining, I'm going to enter that rain and get my 10,000 steps in. And I don't enjoy it. I promise you, it's not an enjoying, but I know that it is good for my body. I want my body I want to be healthy. So it's something I'm committing to for my health, right? Same thing with you talk about intermittent fasting. I ensure that at least once in a week, I do intermittent fasting, right? I love food. I promise you, I love food. So it is not out of, it is just saying I need, and I can give you instances. Again, my scientific mind always looks for patterns. I have seen scenarios, and the medical professionals can tell me, what the exact thing is going on there. Of people who fasted and then they realize that because they don't have food, they notice something in their body. right? So it's almost like, food is almost like drug, right? Where you take food and, you feel happy, you're full and all. And sometimes your body just doesn't show all the symptoms that it's meant to show. But when you don't have food, it feels like all your senses are up and you can feel the little things that happen. And I have seen situations where people found out that they had health issues during their fasting period because they just felt, oh, there's something sharp here. There's some, and then they go in and they're like, oh, thank God you caught it. They would never have caught it if they didn't have a period of 12 hours, 18 hours fast. There are people who have never had 10-hour fast. So your body, you don't even know what your body can do within 10 hours, within 12, 18, 24, 36 hours without food, and all. So I would say when we're thinking about lifestyle, and I guess it goes back to my initial point of just falling in love with yourself, knowing that you are the best investment and you're worth every investment in your health, in your body, then you become more in tune. You want to live longer. You want to look good in the mirror. You want to know if there's anything wrong. You want to get your 8 hours of sleep, because all of these adds up to an holistic person who is aware, who is in tune, who has a lifestyle that can take on the world, that can, drive and implement the ambitions that you have. So yeah, I'm going to stop there.
Thank you so much. That's very helpful. And Shapers, I hope you're listening. 10K steps. Sidebar, we have a current challenge that's ongoing for Shapers, which is we've called it Shaper Stepping. And the idea is to do 10K steps every single day. It's ongoing till I think early November. So I'm just encouraging Shapers on the call to join the challenge, do your 10K steps. It's very important. From what both Abiola and Ife have said, clearly, like, health is wealth and you have to actually take action. And this could look like you're exercising, you're eating well, you're sleeping well, you are aware of, what's going on in your body, your patterns, all of that. Clearly, all of that stuff is very, very important, and could help to significantly reduce the risk of breast cancer. So, that's just something to note. Whilst quick check with the audience, if you have questions, please feel free to leave them in the chat. We're just wrapping up the main session so we can take some additional audience questions. And so for my final, I guess, round of questions, and this is more, I think we've touched on quite a bit. So from factors that make you susceptible to genetics, to the treatment options, or at least discovery options that are available. Talked about breast cancer in men and how it shows up. Talked about what to do next if you get a diagnosis and all of that good stuff. And we've even given a little bit more advice on, preventative care and how to kind of take care of your body and yourself. Something I want to quickly touch on are the actual kind of myths and misconceptions that you hear in your daily conversations and engagements, right? So, for example, you see people online or even amongst friends talk about stuff like, oh, if your bra has an underwire, then you could get breast cancer. Or if you constantly put your phone in your bra or some just stuff like that, right?
Sorry, Abiola. Sorry for it to interrupt. I have a hard stop by 5. I need to go. If you do not mind, it's been great chatting and speaking with you. I know Dr. Stephanie is here and ready to dig into the last question, but thank you so much for having me. My apologies that I have to do this. Yeah.
No worries at all. Thank you so much, Ife. Thank you so much for joining us. So I wanted to just talk a little bit more about some of those myths and misconceptions and to replace them basically with actual facts. What's at the truth and what's at the myths, so that we can, take that away. When people are discussing these things around us, we can say definitively that actually, no, this is the right thing. This is how to approach it. This is, what the facts are. So I will start with Dr. Stephanie. What are some of those common myths and misconceptions that you've been hearing that you would just like to dispel?
All right. So most common one is what I started earlier with. They say breast cancer only affects men, but that is not true. Breast affects only women, sorry, but that is not true. Yeah. So it affects both genders equally, right? Not equally, but it affects both genders, just that women have a higher chance as compared to men. The second one, like you mentioned, is the underwire bra thing. I don't know how that started, but there is no scientific evidence that having underwire bras would cause breast cancer. Heard one of putting your phone in your pocket or putting money in pocket close to your breast. Still, there is no scientific evidence that conclude or that has proven that any of these practices would cause breast cancer. Then we've heard things like using your microwave would cause breast cancer. Microwaves would typically drop electric or electromagnetic radiation, but you actually need ionizing radiation to cause breast cancer. So when I say ionizing radiation, I mean X-rays, and just having one X-ray or two X-rays in a year wouldn't predispose you to having breast cancer. You have to have like multiple 10, 15, 20 in a year to have that predisposition to the amount of ionizing radiation that will predispose you to having breast cancer. Then we had this chit chat in our center yesterday. We had a group of women. We had some breast cancer survivors come to our place yesterday to come and share their experience and all of that. So people got to ask questions, and then this myths and facts came up yesterday. So somebody mentioned she wanted to get a breast augment. We're done with the conversations, like the myths, we had demystified everything. And then somebody randomly mentioned, oh, I want to get a breast augmentation. And then somebody said, you will get cancer. Just like that. So as well, getting breast augmentation does not have any link with breast cancer. We're done with the era where people are putting implants, putting extra chemicals into your breast and all of that. Typically what they do right now is more like a fat graph. So they take your body fat from maybe your tummy, where you have more fat, your back, your arms, and then they move them to your boobs. So there's no chemical whatsoever that is going into that. So there is no link or history or relationship with getting breast augmentations and breast cancer. I think these are the common ones we have around here. Oh yeah, then using plastic plates. Plastic. Okay. You said you're trying to say something, sorry.
My thought was deodorant. I've heard that bit about using deodorant sprays and stuff. Okay.
I'll come to that. So plastic plates in the microwave, right? So I mean, it's not as if there's strong evidence actually, but it's preferred to use glasswares in the microwave. It's just a preference because it's found to be healthier. So to use glassware as compared to plastics and rubberwares in the microwave. Then you mentioned something about deodorant. So I would like to drift a bit, right? So we know that fibroids are common in Black women, right? And then we've heard of people suing relaxer companies for their fibroids. So now the thing is, as Black women, we're not vocal about our problems, right? We don't usually talk about some of these things. And then when it comes to research, when it comes to clinical trials, Black women Black men are not like a major population in these cases. So we form like minority of the cases that are being represented out there. So that is why a lot of cases that affect Black women, like fibroids, breast cancer, PCOS, and all of that, you would typically hear causes like idiopathic, meaning that we don't have enough evidence to support the fact that this would cause this, right? But there's a link. Black women use relaxers, white women don't use relaxers, right? So these fibroids are happening in Black women. So they now found a link, they did their research, and then they found that there's a link, right? So you mentioned deodorants. A lot of white people are they don't use that a lot as compared to us because we have more apocrine glands, we sweat more than them. So we use these products more, and then it's not confirmed, it's not an evidence yet, but there's a lot of research going on around that, and there's been a little of, talk around here and there that some of these chemicals would predispose to. So what we advise is whatever you cannot eat in your mouth, what you cannot put into your mouth, just advise not to put it on your body. So for deodorants, for perfumes, we advise spray on your clothes before you wear them on your body. Don't put them too close to your body when you're spraying. Spray from a distance. Then if you shower regularly, you might not need to wear deodorants very frequently, right? Just once a day or once in 2 days. That's it. Thank you.
Thank you so much. Abiola, do you have any additions?
Well, I think Dr. Stephanie has done due justice to that, but some people say, oh, it's witchcraft, right?
Very valid, especially for our part of the world.
Exactly, especially for our part of the world. So people believe in maybe they are village people, and so they have to go the route of traditional to get some ointment to rub on it, and that once they rub it on it, it will disappear. So I mean, these are the things that I've seen when I was in clinical practice, right? Where we would have patients that literally have stage 4 cancers, and then pastors will come to pray and say that, oh, it's only prayers, that they don't even need to go to the hospital. And then these people come in and barely in 2 days, they pass away just because they've believed the lie that it was caused by a certain maybe ill will from a family member or from a generational cause or something like that. So that is why, I mean, webinars like this is very important to pass on that education to everybody, that when you see anything, please, before you start thinking of your village people, please go to the hospital. Leave your village people, just go to the hospital. Let us start from there. Thank you.
Thank you so much. This has been so incredible. I've learned so much. I'm so thankful for your time. Just a quick check with the audience as well. Any questions, any thoughts, any additions? I see Titi's hand up. Titi, please, you can unmute and speak and share your question. Titi, are you able to speak? Or unmute yourself? Okay, yes.
Yeah.
Okay, yeah, I think I can speak now. Good afternoon. Can everybody hear me?
Yes.
Thank you so much. It's been such an insightful webinar, and I've learned so much around, how to detect the misconception and everything. Even though I wish that I had some particular persons join, but unfortunately. But my question is, I had a friend earlier this year who had lumps in her breast. We detected this since last year. It was even me who went to the hospital, and then she accompanied me, and then one thing led to another. We checked, and then we had to do lots of tests, and then it was confirmed that there was a lump in her breast. And the challenge was that a lot of people were telling her, like her sisters, cousin, oh, that you don't have to take away the lumps, it will go by itself, all of those things. And the doctor kept pushing that it's better that we take out the lumps, and because it might become serious later on. And then it took almost 8 months of persuading her to do the breast check and all of that. So we went for the surgery, to cut the long story short, like 2 months ago. And then the challenging part was I was the one who took the lumps, because I was with her at the theater in Roots. I took it to anatomy, and then they had to do a check. So when the result came out, it was not cancerous. And then the cousins, people were like, oh no, you shouldn't have removed it. We know there was nothing like cancer, They were like, oh, the surgery was so unnecessary. There was just this perception that they had that we should not waste so much money for surgery, the test at the end of the day after removing the whole lumps thing. So, and it's very hard to convince them that, oh, the medical person advised that it's better we take this thing off other than just leaving it there in her body. So, are there cases where these breast lumps can be cancerous? And if somebody have it, how, like, what's like the turnaround time to remove it? Because I have somebody else in my circle who just did detection. So how well do we push them to take the lumps out before it converts to cancer? What are like the timeline in terms of taking it out? And are there cases where these lumps will disappear by itself? Because some of them were saying, oh, it will melt, it will go, are there cases like that medically proven? Or the best way to solve that is to remove the lumps? Thank you.
Thank you, Titi. Abiola would love to answer.
Yeah. I would also want Dr. Stephanie to elaborate. But from my own personal experience, right, I think most times the ideal thing is not just to remove a lump, because sometimes we have benign lumps in our breasts that are fibrous in nature. And by virtue of this, they may not be cancerous, right? And they can be there and nothing would happen, But what is usually advisable is if the person has done a scan, right, and there's nothing there, they wait and then they observe. If it becomes troublesome, maybe it's now increasing in size, right? You need to now take a biopsy, like the doctor mentioned before. Biopsy will determine whether it is cancerous or not, and then there'll be a need for any type of surgery that you want to do. But I always say that before you go the route of surgery, you want to do the necessary investigations first. For example, even doing a BRCA marker test can even help that person to determine whether he or she has it or not, even before surgery. So, I'll be happy if Dr. Stephanie can add to that as well.
All right. So there are quite a number of breast conditions that could give you breast lumps. So we've seen people who during their periods, they have lumps on their breast, right? And then after their periods, those lumps go away. So for those are like, we call them cyclical lumps, right? They come with the period and then they go away with the periods. But then so lumps are usually commoner in women in their, like the benign ones that are not cancerous are commoner in women in their 20s. But it doesn't mean that women that in their 20s cannot have breast cancer. But typically would advise the procedure of a biopsy and procedure for removing a breast lump is almost the same. So why not just take it off? I mean, if you leave it there and you don't check it out, obviously before a breast surgery is done, would have done a scan, would have done a couple of tests. Nobody would just bring you to the hospital and ask you to do a breast lump removal today. That's not true. You would have to go through some processes. You would do tests, you would do scans and all of that, and then they'll advise you to go home, give it some time to see if it goes away. They can give like 3 months, 6 months wait time. And then after they've done all of this, the lump is still there. I would advise anybody to take it out because you have nothing to lose, actually. What if you leave it there and you don't check it out and then you find out that it's a cancer? Because what we do is once we take out the lump, it goes to the lab for testing. And that is how most people have found out that, okay, even in like people in their 20s, that what I just thought was a simple breast lump is actually a cancer. Then what if you just take out a part of the lump and then it becomes a cancer, then it has to go and do another surgery again? Something you have just taken out once. So personally, I recommend if you have a lump in your 20s, please take it out. For women in their 30s, it's a must because for people in their 30s, cancer is very common around here now for women in their 30s. So, and we don't even take chances. For men in their 30s, once we see any kind of lump in the breast, we usually take it out. So if you're in your 30s, you don't even have to be considering is it a lump, is it benign? Take it out, please. Don't even wait.
So, I'm curious. I know someone that has like a lump in the breast, and the person has had it for over 7 years now. Same size, nothing has changed, nothing whatsoever. Would that still be the same advice, even though the doctors recommended that it is fibrous, you don't need to do anything about it?
How old is the person?
Early 30s now, as at that time, I think she was in the 20s or so.
Yeah. So like I said earlier, for younger women, 20, like early 20s, most times those lumps are benign, right?
Okay.
But then if you've had a lump for 7 years, you should be considering that it could there could be malignant transformation. I'm not saying that it's a thing, right? I'm not saying that it's very common, but just take it out. And because somewhere in the back of your mind, you'll be thinking, oh, would it turn into something else? You're waiting for it to disappear and it hasn't gone up in 7 years. So I still feel it's best to take it off so that you don't have anything to get worried about.
Interesting.
Yeah. And then so for people that have those kind of prolonged lumps, they might be estrogen receptor positive, and then the person gets pregnant and then it turns drastically into something. Because I've seen cases where people have had very tiny lumps and then they get pregnant and then it goes crazy, it goes haywire, and then at that stage you cannot control it. It's going like bad. Today there's nipple discharge, tomorrow your skin is breaking, tomorrow water is coming out. You can't do anything at that point, right? So I usually recommend, if you've had it for a very long time, just take it out. And it has, because you're waiting for it to disappear. The person is waiting for it to disappear, right? And it hasn't disappeared in 7 years. That's a lot of time. I think we lost our host.
I'm thinking, because I've got 3 minutes as well. But they,
Sorry about that.
okay.
Abiola, are you there?
Yes, she's back.
Okay.
Yes, I'm back. So sorry, I lost my connection for a bit, but I'm back now.
So we have 2 people raising their hands. If you don't
Okay.
mind.
I think Ella had her hand up first, so Ella can please go, and then we'll take Neka's question as well.
Thank you so much, Abiola and Dr. Stephanie. It's been really enlightening. Just to piggy off on the conversation we're having about, taking lumps out or not. I know it's a debate in the health field, but I just wanted to get your thoughts, especially since we're on this topic on recurring lumps. So if someone has taken out lumps, because I know a couple of people who have taken out lumps and they've come back, and these lumps have been tested as benign through like the needle aspiration. And I know one person was advised to not just continue taking lumps out because it will keep coming back. So just to make sure we have a full perspective, I'm not a clinician, but I just want to hear from your perspective, especially you, Dr. Stephanie. What has been your experience and your guidance for issues like that?
All right, Ella, thank you very much. So for people that have recurrent lumps, if you've taken the first one out and then you have a recurrence, we'll do a biopsy. You don't have to take everything out at that stage, right? You can just do a simple biopsy. And if it's benign, we can leave it there on the condition that you are going to have it checked frequently. So you have to get it scanned on every 6 months, or at least in 8 months, 1 year, just to make sure that it's fine. Because what we're worried about is malignant transformation, right? We're worried that it can turn into something real quick and it becomes a problem and it goes out of something, it becomes something that we cannot control. So if we're going to leave it, it's going to be in a condition that you would promise to get it checked frequently. In 6 months, in 8 months, it has to be a random thing. You have to check on it. You don't just leave it there and then let it be there blindly. You have to monitor. So we don't just wake up one morning and then you see something that we're not expecting. I don't know if that answers.
Thank you so much. Ella, does that answer your question? Yeah.
Thank you.
She put it down. So we take Neka's question, and that will be the last question for the session. So Neka, please go ahead. Are you able to unmute yourself?
Yeah, that's it. Unmute your mic.
Oh,
Can you hear me? Good evening.
Yes, we can.
Okay, so, thank you very much for hosting this show. Thank you very much. So I was going to ask a question. We've talked about age brackets, the 20s, the 30s. So I wanted to ask, is there any age bracket when you don't have to worry any longer about having lumps or anything connecting to breast cancer? And then secondly, I was going to also ask that we talked about changes in the breast, like the orange dot or something. So I was going to ask, is it like one or it just appears on the breast like in full force? I don't really know. I also want to know if you can throw more light on that. So those are my questions. Thank you.
All right, thank you. If I got you well, the second question is the pseudorange on the breast. If it's something that comes out just once, or if it takes some time to show up, right? That was the second question.
Yes, I believe so.
All right. Sorry, what's the question? Sorry, Abiola, what was the question?
What I asked is, does it appear one, or does it come like in a mass, like in mass?
Okay. And then the first question, sorry.
Is there any age brackets where you don't have to worry about lump and breast cancer as a lady?
Okay. So, like I said, breast cancer is an estrogen. It feeds off estrogen. So women who are in their 50s, 60s, who do not who are no more menstruating, who are postmenopausal, who do not have exposure to estrogen. Like I said, exposure to estrogen, because some people, they are postmenopausal and they're still getting hormonal replacement, they're still getting estrogen replacement. Then for those kind of people who are still worried, but once you start hitting 70s, your 70s, we're no more worried about breast cancer, because the incidence in that age bracket is very minimal. There are other cancers that are predominant in women above 70. Breast cancer is not one of them. Then for the pseudo range on the skin, so that's why we emphasize on frequent checks. The ideal thing is to check every month, because like I said earlier, if you don't know what is normal and then there's something abnormal, you might not pick it, right? So it might start, for some people, it might start gradually. For some people, it might just appear all at once. But the important thing is that you know what is normal, so that once you see something that is abnormal, you're able to pick it up. I don't know if that answers your question.
I think it does.
Yes, it does. Thank you.
You're welcome.
Fantastic. Thank you so much, Abiola and Dr. Stephanie. You have really, really helped in terms of providing lots of like education about breast cancer, what to look out for, what to do, how to prevent, what the risk factors are. I think this has really been a fantastic session for everybody who's been a part of it. We're really thankful for your time and for your support. We look forward to continued engagement with you, because again, I guess that's even why Breast Cancer Awareness Month is an annual thing, right? Because it's something that you have to continue to do. And the goal is to continue to get people, aware and engaged. So we're so thankful for doing this with us. To share a little bit more about some of the work that we are doing as legal shapers as well, the Pink Circle campaign is still ongoing. We're still talking a little bit online on our digital channels about myths, about facts. Next week, we're going to talk a little bit more about what to do to prevent, how to take care of yourself. So please stay engaged with us across our social media channels. In addition to Abiola, thank you for being here. And in addition to all the educational resources that we're providing as well, we are looking to raise funds to support women at risk as much as possible. And so we're taking donations. So if you can, please donate to the Pink Circle campaign. We're looking to provide free breast cancer screening to up to 400 women. You can find details on our social media pages. So please stay engaged with us. Thank you again to everyone, to our speakers, Dr. Stephanie, to Abiola, to Ife, who's run off already, and to all the participants, everyone who has joined today. It was fantastic having you. Everyone who has asked questions. It was really, really fantastic having you. We're so thankful that you chose to spend a bit of time with us and learn a little bit more about breast cancer today. And yes, thank you again. Have a lovely rest of your evening. Amazing. Thank you. Thank you for being a part of it. Bye, everybody.
Condition, believe in your heart and you go day alright. No forget say after rainfall and after the dark. keep your heart, my friend. Don't lose yourself in the morning time. The sun will shine. Do your best, but don't lose yourself. 'Cause in the morning time, the sun